Great. Good afternoon, everyone. Welcome. My name is Vish Vishwanath, the director of the Lee Kum-Shung Center for Health and Happiness and professor of Lee Kum-Kee Professor of Health Communications here at Harvard Chan School of Public Health. As you know, so first let me thank all of you in the room who have come to the seminar, and we have many people who are on the Zoom who are also attending this. So there is a large group of people around. I think I mentioned this. Those of you who have attended the previous seminar already know this. This year, given the larger social, political context and the environment, both in the country as well as in the world, we were wondering, what is the best, advice we can provide people. What is the best guidance? And as some of you who know me know that I hate these 5 tips for happiness and 7 tips to do something else, because we are a science-driven, empirically data-driven center. So we have been looking around to see, in the name of this seminar series, Virtues for Wellbeing, we were looking for people who have been doing interesting work, whose work is directly relevant to the times. And so last month, we had Dr. Victor Strecker talk about purpose in life. And we were delighted, that Dr. Sara Konrath agreed to come and talk about her highly empirical work on empathy. She's a professor, a faculty member at Indiana University, heads a center on philanthropy there, but also you're involved with ISR at Michigan, which is amazing. And has written extensively, around issues of empathy and kindness, but also is very prominent in public sphere. She has a blog or a column, as well as given an innumerable number of talks. So she's very comfortable, both in academy, doing very empirical driven work, but at the same time popularizing the science. So thank you so much
for
coming
hosting
and doing
today.
this. We are delighted to have you here. So generally we talk until maybe 35-40 minutes,
Okay.
And then we will open it up for Q&A.
That sounds great.
Thank you.
Thank you so much. And thank you all for being here, both in the room, which I love, and also, hi everyone, I see you and I'll remember you. Those of you who are live online, but also those who are watching later on at some other time. It's okay to fold your laundry, I want you to know that. We can't do it in the room. I do want to stop and say thanks to all of you for making this happen, and to the donors who have also made this center happen. How exciting to be in a place where you're putting happiness and health together. And we get to experience a little bit of that today too. So we're going to start interactive. I wish we could do this with Zoom, but please join in where you are in Zoom. What ways do you give? Does anyone want to share? Just something that you do to give. We all do it in different ways. There's not a right way. Yes? Giving your time. That's a very common way, and there's so many ways. You can volunteer for a nonprofit, you can help out a friend. There's so many ways you can knit something. There's so many, you can be crafty. How about you?
I do board service, and being able to train public servants to run for office, and then after running for office, what it takes to actually be a leader.
Okay, that is amazing. You do board service for training public servants to run for office. And I bet if I asked each of you, there would be a totally different way, right? There's the way I think about giving is we all have like a constellation of gifts. And it's good to know what those are and to share them. And I don't think there's one way that's better than another. I think it's about knowing who you are and what you have and what you can share. So when you give, how do you feel? And I'm a social psychologist, so it's very empirical. It's like we're the engineers of psychology. But feelings are important too, and I want to validate that it's not all going to be good, right? Even if my talk shows you some of the positive side. So think about the last time you gave in some way How did you feel?
I personally felt great.
Okay.
Another motivation of giving was that it will come back to me
Okay.
with a multiplier effect.
Okay, so he said he felt great, and there's this other motivation of knowing that when you give, you also kind of get back. It's maybe the feelings, but maybe other people in your environment kind of are also in a good mood and giving too. Anyone else want to share about the last time you gave? Yes. Hopeful. I love that. I love that we heard the word hope. That's actually my middle name. So I hang on to that in any times. And in times that are difficult, giving can make us feel hopeful, and we can do things. I like how you talked about the small ways, like small groups and small societies. Like this classroom or this room here is a little society today. And the interactions we have every day, even with strangers, is kind of creating little societies. So I'm going to talk to you about the science of giving, and don't worry, all of this is based on data. At the end, I'm going to give you a paper that has like over 200 papers that you can enjoy. But we're not going to see a lot of numbers today, okay? So just sit back and relax. There's going to be some nice slides, but it's all based on data with lots of support behind it. A lot of the studies I'm going to talk about are going to be based on longitudinal data, where people are tracked over time, and where we control for other explanations, or they're based on experiments when possible. It's not always possible in this kind of topic to do that, but when possible, those are the two main types of research we use. So volunteering is the first thing I'll talk about and show you that research finds that people who regularly volunteer have higher psychological well-being. This ties into your last talk about purpose, because people feel happier. That's that emotional feeling. They see their lives as more positive, so that's a cognitive way of thinking about happiness, and they feel a sense of deep purpose and meaning. Giving makes us feel good. Volunteering. It also is associated with increased self-esteem, and it also goes even deeper. It can help with depressive symptoms, symptoms of anxiety and other issues. It can it's not going to fix things, right? But it can give us that momentary feeling of well-being. And if you think about it as a habit, as you do it over time, volunteering is especially good because it's just building a habit into your life of caring. Giving money is also associated, or actually causes, increase in happiness. There's really good work, a lot of it coming from University of British Columbia. Liz Dunn, Laura Acne, many people like that are doing this good work, showing that it makes people feel happy giving away money. This happens even if you're just sitting here right now, thinking about the last time you gave away money. The research shows just thinking about it is actually having an effect. Even when I just told you about this, I didn't ruin it for you. Okay, so the fact that you know this isn't going to take the joy of giving away from you. Next time you give, it's still going to feel good, hopefully, or at least on average, groups who give feel happier than people who don't. The cool part, something I love about this, is other people can tell. So yes, the way we measure happiness is through self-report. I'm totally okay with that. I think that's still valid. But when we also look at people who've just given or not, and we just are measuring their smiles on their faces or some observable like the energy they're showing, we're seeing the same effect. So it's coming beyond just their subjective perceptions, and it's kind of showing up in how they interact with people. And the interesting thing to me as a psychologist is most of us don't know that. Most of us think, when you ask the question, what's going to make you happier? Me giving you some money right now, or you giving away some money right now? What are we thinking? It feels good to get money, right? Of course we want money. We want some more things for ourselves. A lot of us think that, and it's just that when you actually study it, when the scientists actually study it and they actually compare those two, they find the opposite. So there's a little bit of a disconnect. I think sometimes when we're thinking about happiness, the things that make us happy are not always the things we think that they're going to be, and that disconnect can actually be a problem in our life if we can't forecast exactly what's going to make us feel good. Cool studies here. that when people are in these studies where they're asked to give away money or keep money, that the people who give away the money actually feel like they're richer, which doesn't make sense, okay? They literally just gave away money. They have less money, okay? It is not logical, but the feeling is still there. They feel richer, okay? So this idea of scarcity, ever heard of a scarcity mindset? It's a mindset, and like most mindsets, you can change it. You can actually say, well, actually, I have abundance, and if I'm giving $1, I'm still giving, right? It doesn't have to be a huge amount of money. It can just be based on what you have. Is anyone like too busy? Anyone? Nobody? A lot of people feel busy, right? I mean, remember the days where you used to be like, how are you doing? And people are like, good. What do people say now? How are you doing? How are you doing?
Getting by.
Busy, right? Yeah. It's like, how are you doing? Oh, I got this exam thing happening, and like, oh, I got my volunteer job, so, whatever, you're busy, right? So the thing is, we're so busy, and yet the same type of study where people are given the chance to give some time away or not, and when they give their time away, they suddenly feel time rich. They have this feeling of affluence. It kind of relieves them from that common modern phenomenon of having too much to do and feeling that way. So again, ironic, because they just gave away their time. They could have left the study early, but they're feeling it. It's that mindset again, and it's something that is in your control. You can be aware of it, and you can realize you have a lot to give. And what if today you're busy, but all you can give is a smile? That's still giving. I love this study, and this is where we're going to have some audience interaction. So I'm like trying to read the room and be like, who's not going to hate me for this? Okay, the biggest smiles are going to get the money. Okay, so has anyone heard about hedonic adaptation? Okay, hedonic adaptation. Hedonic is like a word for happiness, so like happiness adaptation. It's the fact that this terrible thing in humanity, which is that we just get used to happiness. So someone tell me your favorite food. Shout it out. Tomatoes. Wow. I did not expect tomatoes. About this. I forgot where I was for a second.
Apple pie.
Apple pie. Okay, well, tomatoes and apple pie, we're still kind of have fruit involved. But just say, so it's your favorite food. Now, if it's your favorite food and you eat it for breakfast and lunch and dinner today, you're probably being like, that's cool. That sounds good. Okay, what about tomorrow? Eating that again tomorrow. What about that? What about the next day? The day after that? What happens over time for your favorite things?
Utility goes down.
Yeah, you start to get less into them. That's just hedonic adaptation. It happens with things we really like, right? It's just not good for us. We just get used to it, and then we're just like in this weird position. But I'm going to show you a really cool study by Ed O'Brien and Samantha Kassirer. What they did is they gave participants 5 envelopes each with $5 in it. I didn't have that kind of cash. I don't carry cash, so I had to actually go to the bank for this. Okay, so you have 5, but you get to keep it. And you have 5. Okay, so what they did is half of the participants, let's say this side of the room, I wish I could afford it all. This side of the room, they were asked to give away $5 a day for 5 days, okay? And the only rule was they had to do sort of the same type of thing each time. So maybe they would go online and make a $5 donation to the same charity every day, or maybe they would pay for the coffee for the person behind them in line every day, but it was always the same thing. This half here, you and your peers, would spend it on yourself, okay? Treat yourself today. It could be a coffee, it could be whatever you think whatever you can buy for $5, which isn't much. But something, you can get something nice for $5. But it has to be the same thing, sort of the same thing every day for 5 days. Make sense? Easy study, very cool study. Okay, so in the spend the money on yourself, what do you think they found over the 5-day period? Correct. Look at that. I just saw a graph. I saw that graph. I just saw that graph. Happiness declined, right? This is hedonic adaptation. The thing that you like that feels like a treat gets old, right? Okay, what do you think happened with the giving? Oh, it didn't go up. It didn't go up, but it didn't decline. So this is cool. This is huge. This goes against a major human phenomenon, hedonic adaptation. This is the thing we think that humans face. And here we are. If we're doing the giving, even the same old giving every day, people still feel good. Although there is a little hot tip here. Variety also helps. If you want to kind of maintain that type of the joy of giving, it is good to give to different people in different ways and treat it like a healthy diet of food. Okay, social benefits. Joy of giving and volunteering can spread to others. And I think we all kind of intuitively know this because we see it and we get inspired. Now watch this. Be inspired by this. Look at this. It's contagious. This is the kind of contagion we want to see, right? We're at a school of public health. Don't we want to see that? Yeah. I'd like a little more of joy of giving. But actually research does look into how one act of giving might spread into someone else's network. So if you give that $5 to somebody, maybe they'll give too, and it will spread out. So it's like what you said about the small little connections that we can do in our lives. And we don't know what the outcomes are going to be, but we do know that they can spread. So when it comes to dating, we often see something like a gender war type of thing, right? Like, oh, what do women want? What do men want? We never really know. And it feels like sometimes they don't agree, right? But cross-cultural research says that the number one thing that both men and women agree on is that kindness is what they want in a partner. It makes a lot of sense to me here too, right? If you're going to spend a lot of time with somebody, you want them to be nice to you. And you should be nice to them too. And then also, kind children are more popular. There's a really neat study that followed preteens over time and asked half of these preteens to do 3 kind acts a week. The other half were asked to do 3 new things that week. And over time, when they followed these children and they asked all their friends and the classes around them, what do you think of this person? Their peers rated them as more popular if they had been kind for a few weeks. So there's this, it's not just their self-perceptions of like, yeah, I'm definitely more popular. It's actually their peers saying that they like them more and want to be around them more. So it's the social benefits that are happening. And I don't think these kids were like strategic. I think they're just doing the study, right? And they're getting positive feedback from people. People want to be around them. So we see this with older adults and volunteering. And this is kind of like an experiment type study where there's like a bunch of older adults who sign up and say they want to be a volunteer, and then half of them get to start right away, and the others wait. So it's a waitlist control group design. And there's really good research on volunteering and health in that design. And what they find is that over time, with older adult volunteers, the volunteers end up having more social connections over time, over the 6-month period, whereas the people who are in the control group and not volunteering actually decline in social connections. And it's not just the quantity of social connections, it's also the quality. So the people who are volunteering are also saying, I think I have people in my life who will support me. I think people will be there for me. And when we think about giving, we shouldn't only think about the giver, we should think about their environment and their relationships, because there needs to be mutuality, as I'll get to soon. I've done some work that might seem silly, but was super fun with my colleague Famita Handy at University of Pennsylvania. We were just curious. The people we knew who were really generous, they seemed to kind of glow. They seemed to radiate. And that made them pretty physically attractive, right? Like attraction is more than just, you know, your hairstyle or whatever. It's really who you are as a person. And so we found these data sets, huge data sets, and we examined whether there's a relationship between how people rate physical attractiveness of people. And there are these data sets out there, like the National Social Life, Health, and Aging Project, the Ad Health Study, and the Wisconsin Longitudinal Study. All of those studies do ratings of attractiveness. And the people who do the ratings have no idea about the person. They don't know if they're generous or anything. But those studies also have measures of generosity. And so, 2 of them are longitudinal. What we found is that people who were generous at one time, later on, were rated as more physically attractive. But it was also vice versa. So people who were rated as more physically attractive were also more generous. This is not a new idea. We wanted to think we were being super creative here, but it's a pretty old idea. If you read this quote from the poet Sappho, and she says, he who's fair to look upon is good, and he who is good will soon be fair also. So this idea that generosity or virtue and beauty go together is kind of an ancient idea. And it kind of made us, we used to joke when we were working on this, we're kind of like, why are we spending so much money on lipstick? Maybe we don't need to do that. Maybe we need to be a little more just nice to people. So it's maybe the new beauty trend, I don't know. I don't think it's going to go on TikTok though. I wish. Okay, so you'll get a chance right now to practice generosity. Find somebody in this room, give them a compliment. Online, I'm thinking about you. Send a text to somebody. Send them a little check-in and say something nice to them. It's okay. I know you're on your phone. I love it. I love what I'm seeing. I literally saw you all become more beautiful as you did that. See? It works. And now it's over. Let's see what happens. Do I have to do kindergarten teacher? You needed that. I could tell. Okay. We are now going to talk about the physical health implications of volunteering and giving, and also empathy, okay? And so giving money has these immediate effects on the brain. It activates areas that are associated with pleasure and reward, just like eating good food or sex or any other pleasurable activity that people find good. So it's having the same effect in the same brain regions. It's reducing stress hormones when you give money, like cortisol, which is amazing, I think. I've done some research on this as well, on empathy. That's the wrong, here, that's what I want right here, on empathy and what happens to empathetic people when we do something not so empathetic, which is basically make them do a speech and videotape them. Wait, it's not happening to me right now. But what we find is that the people who are more empathetic have a buffered stress response. So they're still having a little, you need to have a little bit, you know, keep it interesting. But But you should, if you have too much of this stress response in your everyday situation, it's not good in the long term. So people who have high trait empathy have a lower stress response in stressful situations. But there's also experimental work showing that just in that moment, when you ask a person, think right now about how what you're doing can help others, it lowers their stress hormones. So it's pretty powerful. Remember, I talked about mindsets, right? We really can do a lot to change our mindsets and calm ourselves down and be able to handle difficulties in life because of it. Giving can also make people physically stronger, at least in the moment. There's a really neat study that gave people the opportunity to give a little money away or not. And the people who are in the giving money condition could hold a 5-pound weight longer. And if you think that's not very heavy, then you haven't been to Pilates lately. because it gets heavy if you hold it long enough, at least maybe just for me. Yes, they'll push you. You'll find that edge. It's also, volunteering has been shown to be good for cardiovascular health, things like lower inflammation, blood pressure, cholesterol, and so on, heart rate. There's these benefits. It's shown, of course, in older adults, but even this one study in teenagers who volunteered over time. They tracked their cardiovascular indicators and found these positive results. There's also, of course, more physical activity that comes with volunteering because you're often going out there, although you can volunteer online too. But that physical activity is not the only explanation for these effects because a lot of times we're controlling for it. But it's still a real benefit, I think, of getting out there in the community. My research with Eric Kim, who I believe he was at the Harvard, was the School of Public Health? Yes. So we were both at Michigan together. And we found that older adults who volunteer spend 38% fewer nights in a hospital compared to non-volunteers, and controlling for many other things that would explain that. We also found that they are more likely to have preventative health care. So to some extent, I think when we give to others, it often comes with us thinking about ourselves too, because we can't really give in a healthy way if we aren't able to. So thinking as a giver, when you have purpose in life, you want to make sure you're going to be okay and you can do it for a long time. And there's good research on the effects of long-term following volunteers over time compared to non-volunteers. This is longitudinal, not experimental. And what they find in meta-analysis, which is where we put a lot of studies together into one, is that there's Overall, a 47% decline in mortality risk over time amongst older adults who volunteer. When you add covariates and all the controlling factors, it's reduced to 24%. Now, you might not think that seems much, but let's see. Eating 6 fruit and veggies a day.
I'm sorry.
That's okay. Eating fruits and veggies. We came up with fruits, and then it wasn't interesting. I know, that's how it works. 26% decline. So like the things that the doctor tells you to do. And so volunteering, even when you adjust for things, 24% decline in mortality risk. In fruits and veggies, 26%, using the same kinds of studies. Regular exercise, between 23 to 33% decline in mortality risk. And I have a new paper, it's not published, it's coming soon, hopefully, on voting in the presidential election. And it's the first time that we know of that somebody's actually tracked people, older adults, over time to see what happens. And we have found that there is a 28% reduced risk of dying 10 years later for people who vote compared to non-voters, and controlling for a lot of the factors that would predict both health and voting. I think it's exciting. Stay tuned. What about the type of giving? Which type might be best for mortality risk? We're going to have a little vote here because I want you to be healthy. Okay, so there's like giving time of any kind, volunteering, helping friends, whatever. This is giving money of any kind. It could be to nonprofits, it could be to friends and family. And then there's just, having the trait, seeing yourself as a giving person, wanting to be generous. So who thinks the biggest effects are from giving time? Okay, lots of you. That's my unofficial count. What about money? Giving money. Okay, a couple. What about being a generous person? Oh, a lot of you. Ooh, it feels like it's tied between time and the trait. You guys read the paper. You're right, that's what we find. So we find that giving time of any kind is associated with a lower risk of mortality. We think this is about giving sort of bits of yourself. Giving money, we did not see that. We didn't see a bad effect, we just saw no effect. But people do feel happier when they give money, right? So there's still some good things happening in experiments showing that you do feel good. It's just that when you add all the covariates, you're not seeing that it's associated with a lower risk of mortality. And being a generous and kind person is huge. In fact, it's our biggest effect. Again, that perception, the power of our minds, things that we just like, this shocks me actually. Because volunteering or giving, it's like a concrete behavior you can measure really easily. And then someone just believing they're kind, very interesting. Okay, so there's been a lot of research on this. And what's cool to me is that it has been found, joy of giving or any kind of positive outcome of giving has been found in people who are older adults, middle-aged adults, young adults, teens, even younger than her, toddlers. Even toddlers show this, feel happy when they give. It's cool. But there are bigger benefits for younger people when it comes to psychological outcomes. And we think that's because they are still growing their identity and figuring out who they are and maybe figuring out, are they a generous person? Is that how they want to live their life? And there are bigger benefits for older adults for physical health. And this might be because they're having health changes and role changes in life. In fact, there's research showing that people who are retired are benefiting more from this than non-retired adults. And we think it's about kind of volunteering can bring you a new role in life when your kids are gone and when you're not working anymore. This effect is also found all over the world. So majority of cultures in the world are showing volunteering and well-being effects, and volunteering and physical health effects, and giving money and happiness effects. And this is just, I am curious about the other cultures that are the other 14% here. And it's not that they're showing negative effects, it's just that they're not significant, right? But I'd be very curious about that. Speaking of the world, I was lucky to be part of the co-authorship team on the World Happiness Report this year. And it's really big, and I don't know every single thing about it, so there's a lot of data. But I want to highlight a couple things that we found. So one thing is about the effects of giving, like we're talking about. So let's start here. Imagine today I had a magic wand, and I could double your income. Just stop for a second. How happy would that make you? Pretty happy. That's what we think, right? But like when we go across the whole world, yeah, it makes them happy, a little happier. It makes them think that their life is, this is a life evaluation, so it makes them think that their life is closer to the most ideal life they could have. But it's pretty small. Now look at this. What about when they're giving? This is over 4 times the effect on life evaluations than doubling their income. Is that shocking? Okay, but to me it's amazing, right? Because I think we really have not got the memo. We really think that what's going to make us happy is getting more, when what really makes us happy is giving more. We are a social species. We need to give. We also need to be in environments in which other people give. So there was a question on the wallet return. Have you heard about the wallet return studies? They've done these studies all over the world where they've literally dropped wallets with money in them to see if people will return them. We didn't do this with the Gallup World Poll here. It's just a survey. But that perception, that belief that if somebody dropped their wallet in this room, that somebody would return it, that really matters. That's a kind of a way of getting at trust in your environment. That's even more important for life evaluation, 7 times bigger than the effect of doubling your happiness. But when I see this, what I see is both together. It's not just about you giving, it's about being in environments where you trust that others are giving too. Those 2 things matter. And I also wanted to give you some good news. We need good news. Good news is after COVID, this is the global pro-social behaviors from the world, the Gallup World Poll. After COVID, giving went up, and it's pretty much still up compared to before COVID. That is great news. I think we need it, and I think a lot of us didn't know during COVID that generosity was activated. Okay, economic benefits. Here's the funny thing about it. It's a tricky topic because as soon as we introduce the topic of money, lots of research shows that actually makes us less pro-social. So I'm sorry to you and to you. And also to all of you who saw the $5 bills. But really, studies will show like a $5 bill or something, right, in the background. And people will be less generous when they see money. So it kind of deactivates our generosity when we think about money. But in studies I'm going to share today, it was just people being nice and then being tracked over time. So it wasn't quite this priming of money. Here is an example. One study looked at kindergarten children. These are 5-year-old children in a low SES environment. And the teachers are rating them on things like how much do they give, how much do they think about others, are they nice, things like that, right? And then the researchers track these children for the next 13 to 19 years. They're till they're young adults. And they find that the children who teachers rated as more generous when they were 5 years old are doing better economically when they're young adults. They're more likely to get in college, and they're more likely to have a job. To me, that's powerful. We have a new paper that just came out that tracks teenage giving, specifically volunteering for nonprofits and giving donations to nonprofits. Teens are doing this stuff. It's cool. It's based on national US data from the PSID, Panel Study for Income Dynamics. What we find when we track teens giving money is that they are more likely to go to college and have a job when they're young adults. And when they volunteer, they're more likely to go to college when they're young adults and have higher incomes. So there's something happening. I think it's about social things. I think when you're volunteering, you're getting to know others. You have mentors and peers who are shaping your way. You have pro-social environment who would return your wallet. There's lots of good things happening. But we really don't know mechanisms. We can only guess. So how do we give more sustainably? That's the topic of today's talk. And I've given you little tidbits here and there of how to do it. But in the World Happiness Report, we came up with 3 C's. And Laura Ackman, who's one of the co-editors of the report, is a world expert on this topic too. So we both really scoured the literature and came up with what we thought were the best principles so that we ourselves and others around us can learn to give sustainably. First one, we've talked about already a little bit, but it's about caring communities. So it doesn't just mean surrounding yourself in pro-social communities. That's part of it. It's being comfortable with not just being a giver, but being a receiver. And that reciprocity and mutuality that happens in healthy relationships and healthy communities. And any community, it could be where you go to school or where you work, right? Or your religious environment or whatever, your community, however you define it. But this caring communities idea, we put the word caring in there because it's a cue to remember that your motivation really matters too. So in research I've done where we've tracked older adults volunteers, we've asked them, why do you volunteer? And we find that that really matters for their later mortality risk. The volunteers who say, I do it because my loved ones, it's important to my loved ones, they actually are less likely to die a few years later. And the volunteers who say, I do it because I care. I care about this issue, I care about people, I want to help. Those people also are less likely to die. They also, other research finds, both of those motivations are also associated with more happiness over time as well. So caring communities, it's about you giving. It's about you giving for the right reasons. And it's also about you receiving, creating those mutual communities. We're all part of them, and we can make our small groups better. So here's some suggestions. Whenever possible, give with others. I'd say give in person if you can, but we get these benefits even when we're virtually giving. Give because it's important to loved ones, because you care about the cause and you want to help people. These are things we get to change, right? Our mindsets. Next, choice. The second C is choice. First one's caring communities, second is choice. Who likes it when someone tells them what to do? If you put up your hand, I will tell you something to do. No, just kidding. I'm like, I need some help with some research or something, checking data. It doesn't feel good usually, right? And yet there's a lot of programs and situations in which we are telling people to do things, voluntold, right? Or like mandated volunteering programs or something. I like when we are creating a better society. I like that high schools now have volunteering programs. I just think we need to think through how to have choice in these things. People have higher benefits of giving. Givers experience more joy of giving when they're choosing how they're giving, to whom they're giving, all of the different details, right? So when we're working in programs that require some sort of volunteering, thinking through how to make it personal and real and let people have agency and decision making over it. There's good research to support that we need to do this. The third C, all right, so for your action, find your own unique spark as a giver. We talked about the constellation at the beginning. The way you give is going to be different than the way I give, and the way you give is going to be different than the way you give. We all have that. That's okay. It's good to know who you are and how you give and just practice it. The third C is make a concrete, positive impact. We made it into a C, basically. That's what we did. Or we tried. Was this before ChatGPT? No, just kidding. We did it with our own brains. But basically, there's research, lots of research showing that, when you give in this abstract way, it just doesn't feel as good. And part of that is because you don't really know if you're making a difference. So for example, I give because I want to make the world better. I'm never going to know, right? But today, I just want to make you smile. See, that was easy. But that felt good. Concrete, positive impact right there. But it's easier to make someone smile than to make someone else happy, right? There's one study that showed that you give people $10 and they can choose to either, half of the people who have $10 either are told that it's going to a mosquito net to prevent malaria for children versus it's going to go help a lot of children in the world. Which one do you think makes people happier? Mosquito net. You can really feel like you're making a difference to somebody. That is how to give in an effective way. Now, can we do it at scale? Yes, we can, right? But we just have a brain that is built for empathy. And so empathy is about one-on-one. Empathy is about the people around us. And I think we can start with that and we can expand it, we can grow, and we can think about that person, that child who needs a mosquito net as part of our circle of care and feel the impact and joy of giving to that person too. So find specific ways to make noticeable improvements in others' lives. And I think there's different ways to do this. Perspective taking is a good way. Just imagine what they might need, but from their perspective, not yours. And the thing is, we're not always good at this. And researchers call this perspective mistaking. So we can get it wrong, although it's good to try. And it's a very effective empathy practice. But when we're not sure, we should just ask, right? Have you ever given a bad gift? I'll just say yes. I have. Because I thought I knew what the person wanted, and I was just, yeah, they would love a chocolate fountain. Well, now you know what I would love. But sometimes you should just ask, right? Just find out what they want. So here are the 3 C's. I hope they're helpful to you. I know you're wondering about limits of giving. I think that one of the reasons I'm even here is because we have to talk about sustainable giving because some of us get drained from it, right? That's real. I do want to show you that this joy of giving stuff, the benefits of giving, have been found in remarkable circumstances and lots of difficulties. So people with lower incomes, disabilities, cognitive impairments, mental health struggles, people involved with the legal system, and during difficult times. These effects have been tested across those different environments, and they still exist. But it doesn't mean you should feel bad because you feel bad when you give, okay? There can be limits. Giving is required, that's one of them. When volunteering too much, you lose the benefits. It's not that you feel necessarily less happy, but you just don't get any additional benefit in research. When giving money, from what I've seen, I've looked at several studies on this. I haven't found one that found that when people give more, they feel less happy. But that's because most people are not giving that much. Okay, so I would say, yes, it's reasonable to be like, if you're giving so much money that you can't eat anymore, or you don't have what you need for yourself and your family, of course it's not going to be good for you, right? But most of us are not giving enough, actually. We can push on that. But I think where this feeling comes from of like, there are limits and we get depleted from giving, is really about the core of empathy, right? Because there's a belief that empathy can make us burned out. It's too much. It drains us. There's some people who say maybe it doesn't, maybe it buffers us, but I've heard more, especially in medical contexts, healthcare or social work or education, that too much empathy is draining. So we're going to vote again. You're going to be so healthy by the time you leave. Except for the pizza. Forget the pizza. I like pizza. Okay, so who thinks empathy makes people more burned out? Put up your hand. Or who's heard it and kind of thinks it could be true? Okay, a group of you. What about empathy maybe buffers people from burnout? What do you think? Okay, so some of you think that too. This is one of those votings where you win no matter what. It depends on how you define empathy, right? So if you're defining empathy as feeling other people's feelings, then it's associated with more burnout. We don't know if it really makes. I think that's not the right word. It's correlated. But we have a new meta-analysis that actually looks at this. And so feeling other people's feelings can be problematic. It can cause you to feel, or could make you, or be associated with at least more burnout. But if you're compassionate, or you're imagining their perspectives and feelings, that's actually a buffer. So just to reiterate, if you want to have sustainable giving, find your own spark and figure out like why you do it. So that purpose piece that we heard about in the last version of this series. And then be kind to yourself when you don't get it right, because we're all human. And we're all in these embedded environments and in relationships where we just kind of give and receive and try again. You know, it's okay. This is not something that anyone is ever going to be perfect at, right? We just have to be willing to try and care and do it for the right reasons and with the people around us. So I think we have a few minutes left. Thank you. I know that was a lot.
We have time for a couple of questions.
Yes. Oh, just if you want to download the stuff, it's there. Good luck with the 200 papers.
I'm curious of an example that was at a scale at such perhaps some of us have heard of it, but elicited some of these responses exceptionally well. And what made me think of this is when we talked about the malaria example, like for the malaria net, like I know a lot of orgs start to see it, you can sponsor a child specifically.
Yes, that's very common.
Like, do you think that's a good example, room for improvement? Are there any others that kind of pop to mind that may be commonplace enough that you might have seen?
I think that's a good example. I think fundraisers, I've studied fundraisers, they're exceptionally empathetic compared to national population norms. They kind of intuitively seem to know how to design appeals in ways that really mean something for givers. And so an example of, yes, sponsoring an individual child, because it maps onto what we need, which is that one-on-one relationship or that small, the kind of the family style type of relationship that works for us. So I think anything that makes it more personal, that gives the person a name and a story, any kind of storytelling is effective. And like as a giver, you want you want to, especially if you care about the outcome and you really want to make a difference, like you want to know that you're going to actually better people's lives. So in any way that people who are working in this domain can make that more real, that's what I'd advise. And it's just part of our human cognition. Like we just have trouble, we can't really empathize with groups. There's research showing that. We need to kind of empathize with one person at a time, or just small, like people we would naturally see. So that's a good example. Are there other questions or thoughts?
So since we're in a public health setting, I feel like we've talked a lot about the individual benefits, but you also talked about the tricky aspect of like making it to scale and making it maybe like, you talked about some high schools are doing volunteer like requirements and things like that. Have you found any really good examples of kind of systemic scale things that have been beneficial to like an entire community's health?
Yes, I think that the idea of some high schools doing it is actually state mandated is what's happening in the U.S. is that states are mandating volunteer hours in high schools, and also more and more states are mandating social emotional learning in the classroom, which helps build that empathy, which has then those kind of the pro-social behaviors, and giving comes often motivated often by empathy. So those are good examples. I think no one has studied them yet in terms of like the scaled outcomes, right? So when SEL programs got implemented, did that make a difference in the population of that state? That's a very good question, and it could be studied.
So, people have to go to classes, so we will stop here. I know there are other questions, but thank you so much again for coming.
Thank you.
Absolutely wonderful. And we have also interviewed Dr. Konrath, right? So we'll have a podcast, so you'll get to see more of her, even if you don't get to see that, read the 200 papers.
Well, luckily that thing there is it's a fact sheet, and it's short, and if you want the full chapter that describes these studies, you can go to them. But I tried to fairly summarize them here.
Thank you.
Too much
Very
information.
kind of you. Very kind of you.
Thank you. Very kind of you to invite me.
Thanks so much.
Thank
you all
you.
again, and thanks for those people who are on this.
Bye, everyone online.